Hello guys. Welcome to Sheeri the Preventionist show. This is another powerful episode. Here we talk about small doable actions but making a big difference when it comes to health matters. Today we are so privileged. I promised you guys that I'll be bringing guys and guests that you've never seen. Today we have crossed the borders and we have a special guest with us. In a while I'll be introducing you because she'll be telling us about Africa and she'll be telling us about abroad. Wow, what a privilege. So I am so honored to host the guest for today, and I know as Africans and Kenyans we will get a lot of insights from her. Without much ado, welcome together with me my guest, Madam Emma Tufon. She'll be telling us more about herself, her journey, where she's working, but she's an experienced health professional. Welcome, Emma.
Thank you very much.
How are you?
I'm good, thank you.
Karibu Kenya.
Asante sana.
Wow. Yeah, and this is your first time to be in Kenya?
Yes.
Karibu. Yes, so we are so privileged to have you today in Sheeri the Preventionist show. This show is just to help people and encourage people to embrace disease prevention. You know, just not to be reactive, but to be proactive. The small things that people can do either at home, in the community, or at workplace just to prevent diseases. So we are making it as basic as possible. But because you are a professional and a scientist, you can even bring it, you can bring the science in it, so that we can have insights on why we're talking about health promotion. Karibu. So you can tell us about yourself, introduce yourself so that my guests can be able to know more about you.
My name is Emma Tufon. I've been a nurse for since 2009.
Wow.
Yeah, and what pushed me to nursing is actually this disease prevention and health promotion. When I was a child, there were these magazines that I usually go through. Yes. You know, children like magazines with cartoon characters and everything. So there were this magazine that had different pictures of how to prevent diseases, how to prevent malaria and other diseases. And I got interested. And as I grew up, I knew I would want to prevent people from getting sick as much as I can and help those who are already sick.
Yes.
So when the time came, I went into nursing, and when I graduated, I didn't want to stay home waiting for the government to employ me.
Yes.
So immediately I graduated, I went into voluntary work. And while working, one of the doctors admired my work there in Yaoundé, Seyashu, and then took me in for private practice. I worked in a clinic, and during that period, I made it into the public service. So I worked with the government for a couple of years before I migrated to the UAE, where I'm currently working as a nurse. Yeah.
So yours, I like what you're saying because yours is more of passion and a calling, because since you're a small girl, you admired things to do with health.
Yeah.
But just to take you a little bit, so you're telling us when I was a small girl, where were you? Which country?
Oh yeah, in Cameroon.
In Cameroon. Yes. So all the formative years you grew up in Cameroon.
Yes.
And that is where you did your nursing.
Yes.
Then you worked for public service. At what point did you now transit to where you're working?
I worked in the public service from 2009 to when I moved to the UAE. That was in 2000, at the end of 2012. So but I was still transitioning in between until I finally settled in the UAE.
Now you are settled and working in UAE as a nurse.
Yes.
Yeah, which Emirates precisely?
In Abu Dhabi.
Oh, Abu Dhabi.
Yeah.
How is it working in Abu Dhabi? You know, you said you worked in Cameroon in the public service for some years, then you transited to Abu Dhabi in UAE. Yeah. How is it? Have you noted any difference? Generally, how is it?
Yeah, there's a difference in because it's cultural difference.
Yes, cultural
the patients are different, the
Yes.
cultures are different, the approach to healthcare is different, the healthcare system is different. There you will have a family-oriented kind of care.
Yeah.
So you don't just treat a person as an separate entity, you treat as a family. And sometimes you need to seek the opinion of the husband or the father before coming to a conclusion. So there are some of those differences.
Interesting.
Yeah.
You're saying if I have presented myself as Sheeri in the hospital, I cannot be treated until my family members are consulted.
Not really. You
Yeah.
can be treated, but there are some
Yes.
procedures that will not be done unless your husband, if you're married, has consented to it, or unless your father, if you're not married, has consented to it.
Wow. So it shows that is it a good thing or a bad thing? According to you, does it delay promptness of treatment?
Yeah. Yes, it's positive and negative.
Okay.
It's positive in the sense that it uplifts family values.
Oh, yeah.
The father is the head of the family,
Yes.
and his opinion should be sought after. But at the same time, if the father makes a wrong decision, it will affect the patient. Same thing, a married woman will definitely need the consent of her husband before doing certain procedures. But if the husband doesn't make the right decision also, she will be affected. So to be on the safe side as a healthcare professional, you just want to make sure you don't get into trouble, make sure whatever you're doing is legal and is cultural. So you consult those that need to be consulted before coming to a conclusion.
Okay, okay. Yeah, because maybe, I don't know, are there communicable diseases in UAE?
Yeah, there are communicable diseases and there are non-communicable diseases as well. And non-communicable diseases are even more rampant. And there's a high rate of mortality from that because about 55%. So, and there are preventive measures for it. You find, especially cardiovascular diseases, it's killing a lot of people. It's accounts for about 35% of the deaths from non-communicable diseases. And we have communicable disease as well, and there are precautions that are being put in place to prevent. We have different precautions: contact, airborne, enhanced airborne, droplet precautions. Measures are in place, and many of the hospitals are JCI accredited, Joint Commission International. So every 2 years they are being evaluated, and if they make it, their hospital is sought after because of the quality. Yeah, so hospitals do their best to make sure they follow the JCI rules. They make sure they comply with all the JCI measures. They make sure they identify patients correctly using their dates of birth and names, so they don't mix up patients. They make sure high alert medications and other sound alike medications or look-alike medications, they are put apart. There are ways of identifying each. They make sure there's effective communication, SBAC communication between health personnel, be it on the phone, be it face-to-face, in whatever situation.
Meaning the systems and the procedures are very strict and very structured and detailed. I wanted to take you back a bit about what you're talking about. People are treated as a family, and you say that they are communicable diseases. I thought it's a good thing because if it was a communicable disease, all the family members will be treated.
Exactly.
And now it looks like in UAE, like men have really embraced access to healthcare. I don't know in Cameroon what happens, but in Kenya sometimes you find that men take very long before they go to seek for healthcare. Yeah, I don't know in Cameroon if that is the case.
It's a common thing.
It's a common thing.
I don't think it's only limited to Cameroon. Even in the UAE, most of the time, women are more solution-oriented or health-oriented than the men. Most of the men will want to wait until the illness aggravates before they go in for treatment. Most of those you see going in for checkup, like annual checkups, are women who check themselves up. Most of the time you find men above 40 going in for prostate cancer. That's the most they can do, to go in for screening. But before that, they will barely check their BPs, their blood pressures. They will barely check anything else. And
so they'll make decisions for their family, but for themselves to go and access those screening services, they will not do. But they'll make the right decisions for the family. That is very interesting. Now, still on that thought, maybe you can also mention some of the common causes of illnesses there. You've talked about the cardiovascular diseases taking quite a percentage. What other conditions are common there? The communicable and non-communicable.
Yeah, for the communicable, you have different diseases. You have flu.
Oh,
that's something that is
common.
It's seasonal.
Yeah, seasonal because of the climatic changes.
Yes,
yeah.
And also you find children also suffer from that growing up because it's a desert environment.
Yeah.
And sometimes there are some seasonal changes that affect children. Sometimes some children have allergies because of the environment. So you have many children who are, and then there are other kinds of there are other kinds of diseases that mimic COVID, and which are also being treated. Once in a while, you have diseases that come in that the patient is isolated and treated, and it doesn't spread. You have the periods where we have hemorrhagic fevers, and we'll isolate the patient, and the treatment will be so strict.
Yes.
You find health personnel who go in. Each time they go into the patient's room, they have to take a bath and change everything, change their attire. Next time going to the room, same thing, just to prevent spread.
Infection prevention, even in the hospital.
So that strict?
Yeah, the IPC, infection prevention control, even in the hospital is very strict.
Yeah. So we have, in general, we have communicable diseases like influenza. We have MRSA, COVID, which is a common one, the seasonal flu. We have MDROs, Candida auris. There are organisms that you find there that are not common in other places. For non-communicable diseases, we have diabetes.
Hold in there, Emma, kind of, because there are many people who are watching us. If maybe there are diseases you could mention as a full, not the initials or what maybe the medics would call it. Just simple terms that people can be able to.
Okay, the ones I called using the abbreviation are diseases which many people get while in the hospital. Yeah, there are these diseases that are hospital acquired.
Okay.
Yes, they come into the hospital, maybe long-term stay, it could be short-term stay, and they get resistant to certain antibiotics.
Yes.
Because they have been exposed and certain drugs are being prescribed which are no longer effective. The antibiotics are no longer effective. They could have a wound that is resistant or an infection that is resistant to treatment. Those are that I'm trying to explain.
That's very nice. Yeah. And imagine you're just concurring with somebody. A few days ago, I had interviewed one of the professors in Kenya, and he was talking about the antibiotic resistance in Kenya. So this looks now like a global issue.
Yes, it is.
Because now that is your issue in UAE. Many patients they are experiencing that, and they come to the hospital, and that is now the challenge that is there.
And also when that happens, health insurance will not cover because they take it as the hospital's fault. Yes, the hospital is at fault. The patient got in without the disease. How come the patient is now present in the hospital or living with the disease in place? So they don't cover, and that is a loss for any health institution. So they do by every means, they take every measure possible to prevent it, to prevent transmission to another person or to healthcare workers. So measures are taken. If it's contact precaution, they make sure they have a full PPE.
Yes.
Personal protective equipment.
Yes.
So they can be able to contain the disease and eradicate it.
And I really like what you're saying, because you are really proving to us that prevention is the way.
It is.
It is the way, because when somebody is in Kenya, you may think like in United Arab Emirates, they are so ahead. Some things are not common, but we hear that there are things that we are sharing in common, meaning that still prevention is valid.
Yes.
It is not like an outdated thing, and it's something that people should embrace.
Exactly.
And guys, that is all we talk about in Sheeri the Preventionist show. Being responsible of your own health, things that you can be able to do to prevent the disease. Because I've heard you say that there are people who take even long in the hospital because of something that could have been prevented.
Exactly.
The cost the time wasted. When you do the economics of that disease, it becomes very expensive, and it's something that was preventable.
Yes.
Yeah, carry on, please.
Yeah, and in that light, I remember writing a booklet also, just to prevent diseases back home, like during COVID. When COVID just broke out, I was like, how can I prevent this? And I read and wrote the book. I wrote it in English and in French, so everyone will be able to read.
Wow.
And I sold and shared. Because I couldn't just wait for people to buy.
Is it available? Even now, is the book available?
I ended up sharing the books. I shared to schools. Maybe I will do something about putting it online or making it available.
Yes.
But then I just shared because COVID
put it on
was
Amazon or something, or even ebook that you can be able to read that kind of piece, because what I like is that you are writing out of experience. You know, there's something you can write hypothetical, but for you it is out of your experiences and what you've seen work in UAE, and you put it together in a book. That is lovely. Congratulations for the book.
Thank you. And I think you can do one too. English and Swahili.
Perfect.
It'll be very good.
Perfect.
Do it for different diseases.
Good idea.
And make them available.
Sure.
So people who watch, children can also read in school. They can implement it in schools. It'll go a long way.
And for reference.
Yes.
Yeah, exactly. Good challenge. That is good challenge. We can still go now. You are telling us there's a point you'd reached, and you're talking about now patients, they put on their wearables for monitoring.
Yes.
Yeah, maybe you can just explain that further.
Yeah, for the non-communicable diseases, diabetes, cardiovascular disease, there are wearables for, like we have the bio button for the cardiovascular diseases. The patient can bio button. Bio button.
Button.
Yes.
Okay.
Yeah.
That you can wear.
Yeah.
Yeah.
It's one on the. It's pasted. It's like it's stuck on the skin. You can bake with it. You can do. Yeah. Yes.
So it's not stuck on the cloth.
Not on the cloth, on the skin.
On the skin.
Yes.
Through a surgery.
Not surgery. You actually put
it's like a sticker.
Adhesive tape.
And you
adhesive
apply
tape. Yeah. You apply the button on it, and it's connected to a biohub that gets data, processes the data, and the patient's vital signs can be monitored. And if it is abnormal, measures are taken.
You are called. Are you called?
Yes, there's a command center that monitors it. Monitors, and then when it's abnormal, they can ask the patient what is happening, just to make sure it's authentic, and then they take measures necessary to treat. And this is done while the patient is at home.
Okay.
Yeah, and
it's very interesting.
Yeah, and patients too who are diabetic, they don't need to wait for their rendezvous or appointments to go to the hospital for checkup. There are also wearables and machines that they just put. They don't actually. It's such that it's into the skin, into the blood vessel, so that with the machine, you don't need to prick yourself every time.
Yeah,
you just come close, and the sensor it's reading, and you get the reading for your blood pressure for that particular time.
Again, is it communicated to a centralized place?
Yeah, it's such that the patient can see for himself or herself, and if the patient is on maybe insulin or whichever medication, the patient knows what to do. If the patient needs to call a doctor or a nurse, the patient knows what to do.
Wow.
Yeah, so those are just a few examples. Not limiting the preventive measures or measures put in place, not limiting them to the hospital, but taking them right to the patient's home. That way we can prevent complications that may come in.
Sure.
And that way we can monitor patients too from home.
Self-monitoring.
Exactly.
Yeah, and it is very important for people to be responsible of their own health, because we are not with the doctor throughout, Emma. So when a patient is empowered to be able to monitor their own health and take prompt action, that is a good thing. So thank you for that. And and here in Kenya, just out of curiosity, there are people we call public health technicians and public health officers. They do all the disease prevention activities. They do to restaurants and hotels, do inspection of food quality. They monitor the water quality. They go to schools and monitor school health, such like things. Are there such kind of people in UAE?
Yeah, there are. First of all, in the hospital, we we make sure everyone is aware, and it's every caregiver's responsibility to prevent diseases, to take quality measures, safety measures. Everyone is responsible, and the approach is a problem-solving approach. It's not a blame culture. So if there is something that goes wrong, it's not to blame the person responsible.
I like that problem-solving culture.
Yes, exactly.
That is what has been calculated.
People speak up when there is an adverse event. They make sure they speak up so that measures can be put in place, and there can be an action plan to prevent it from happening in the future. Then from time to time, the Department of Health will come to for audits. When the audit is impromptu, it is more authentic than when they announce. When they announce, the healthcare personnel can pretend, and the results will not be authentic. And then we have outside, you have this Baledia. It's a body also that inspects restaurants.
They're called
Baledia.
Baledia.
Yes. Wow. They inspect business places, they inspect restaurants to make sure it's qualitative. And there are also other organs that are in charge of inspection.
I like the Baladias because I think I'm also one of them. I'm trying to be one of them. Here we call them public health officers and public health technicians. They do what we call sanitation in the hotels and restaurants. And even here, when restaurants know that they are coming around, they can do a thorough cleaning, because they can even do prosecution. I don't know even there if they do prosecution.
Yeah, they can close down the business. They can close the restaurant.
Here they close, and even they can take something to court if it allows or it demands. Oh, thank you. I think that you're giving us very important insights, and there are things that are so much informative. Like I like what you're saying about self-monitoring aspect of the patient, because in Sheeri Preventionist show we talk so much about my health is my responsibility, and your health is your responsibility. And together as a society, our health is our responsibility. Because if each of us is proactive, we'll stop being a country, a nation of being reactive to being proactive, and we will improve quality of life as much as possible. So I know there are so many nurses right now, Madam Emma, who are watching you, and they are admiring you, and they are saying, wow, she works in UAE for all 9 years and she's doing a wonderful job. How can we get there? Is it possible?
Well, I would like to tell whoever is watching that is interested, if you're from the UAE, then okay, be encouraged. But if you're not from the UAE, no, grass is never greener on the other side. Just remember that. Be contented. Love where you are. Improve on where you are. Wow. Sheeri the Preventionist is here. She's giving you all the details you need. Everything you need to succeed where you are. Because migrating, going to another country, you lose, your community loses, your family loses, the whole country loses a brain, loses someone who is very instrumental in the health system. When you leave, the country is handicapped. There are many countries now in Africa without nurses. You go to a health center and all the nurses have gone abroad. No one is available, no doctor. People want to deliver, there is no midwife available, they end up delivering at home. They end up going to traditional birth attendants. You find people dying of diseases they shouldn't have died of. You find the hospitals empty. You find the specialists all gone. You find even those who should encourage people to stay, they themselves, they go for treatment abroad. They go abroad, what happens to the citizens? They go abroad for treatment, and the citizens are left. And what betide you if at all the disease does not permit you to go abroad, and you're caught in the hands of the same people you neglected to train, or the same people you neglected to form, or the same hospitals you neglected to equip. You'll be like, what goes around comes around. So I'm encouraging whoever is watching that is interested, think of where you are, think of how you can improve where you are, and if you need to go out by any means, there's a website available. You can check the Department of Health website. You check all the requirements, you do the necessary compilations, get the approval, because it's a process for approval of documents, get the approval, and choose a day for exams, go in for the exams before you can work. And it's always better to do this before you travel, because you will find nurses who travel without doing this, and because the verification takes a long time, they end up becoming cleaners. There are many nurses like that, yes, who are doing cleaning jobs and other jobs just because their visas were expiring and they got so desperate to do anything. So if you really want to continue in the same profession, make sure you take the necessary steps to prevent going into a path that was not meant for you.
Thank you for that. So you're saying home is always the best.
Home, sweet home.
Sweet home.
There's no place like home.
No place like home.
We discourage brain drain. We need you.
Thank you. And maybe you are also encouraging build where you are.
Yes.
That is what you're telling us.
Yes.
Thank you so much, Emma. It was
and in case you're thinking that because she's abroad, she doesn't want us to go there. I went there because of marriage. I didn't go there to go work. Just in case you're judging me.
You heard from the horse's mouth, from Emma herself, a reason of moving, and she's encouraging us African countries, we have all that it takes. We can invest all the resources that we have in our beautiful countries because we are sharp, we are bright, we are resourceful, we have everything. Instead of taking our patients abroad, we can build ours right here in our countries.
Exactly.
Thank you so much, Emma. It was amazing talking to you. It was so much informative. We've learned, we've enjoyed everything. But now, before you leave, you can give us a parting shot, including your passion. A parting shot and your passion, and even how we can be able to follow you on different channels.
Right now, Sheeri is doing an amazing job. So I'm not doing anything health related at the moment. I mean online, on social media. Yes, so the contributions I can make through Sheeri's.
Thank you. Thank you for that.
I can contribute. And the messages I give online, you can follow Emma Tufon. It could be on Facebook, it could be on Twitter, it could be on TikTok. I'm available. I have different messages. Not all are health related. Different messages on different topics. So you can always reach out and you'll have something to benefit from it.
Thank you. Parting shot.
Home is always home. There is no place like home. Home, sweet home. We need you. We need to build our homes. We need to build our hospitals, our health systems. We need to build our countries.
Yes.
Let's always remember that we are working for a purpose and we are God's instruments. We are not just into the health profession for the money. We are not just there because it's a way out. You find many who go to the US and because they think, nurses are well paid in the US, they should do nursing, and which is not their calling. It's like teachers in some countries who go into teaching just because that's the easy way out, when they are not called to teach, and they teach and children don't understand, or they end up doing things they should not do. So let's be mindful of our callings and do it as a vocation. If you're a healthcare professional, do it as a vocation.
Yes.
And if you approach it as a vocation, you give your best. You treat the patients the way they're supposed to be treated. You take all the preventive measures, and life will be better with you present.
Thank you so much. Thank you, Emma. So we are fulfilling a divine purpose.
Yes.
It cannot be better. That is the best ending, that we are fulfilling a divine purpose. Thank you for watching. Thank you for your time. This has been Sheeri the Preventionist Show, where we talk about small doable actions making a big difference in health, because prevention
is better than cure
and cheaper than cure.
Exactly.
All the time. Can we say that together, Emma? Prevention is cheaper and better than cure all the time. And then from there we finish with a laughter all the time.
Exactly.
Keep safe, stay healthy.